Hello everyone, welcome back to Fact Facial Assessment with Clarius Technology. I'm Dr. Roya Zarmerzamin and this episode is about safe mapping of facial vascular anatomy. It's very important because facial vascular anatomy is very complex, and because it's complex, you never know what is beneath the skin and which layer the vessels running through. It's important to mapping before the treatment plan. It means that if you're going to inject supraperiosteal or going to use cannula, you need to know where exactly you can place your product, which tools you can use, and what is safer for your patients. That's why ultrasound can help in just determine the most precise and safer and natural outcomes. Now, for the scanning of this episode, I'm going to show you a few danger zone, like just more risky area, because there is no safe zone in the face. But I'm going just to pick some area, for example, piriform fossa to find the depth of the angular artery, infraorbital area when we are going to treat medial cheek, templar fossa, and check the supraperiosteal vasculature if there is a variation for gunshot technique, and also superficial vasculature. And we're going through the supraorbital and supratrochlear arteries to show you on the glabella area for whoever doing treatment, especially dermal filler for the glabella, which is very risky. Let's start our scanning. I'm using Clarius L20 linear probe and start from the piriform fossa. For the piriform fossa, I use the preset of piriform area, and then mostly you need more gel, a thicker layer of the gel to just fill up this concavity here. With zero pressure, you can scan the vessels and all the measurements going to be correct. I'm scanning transverse. Make sure that I'm seeing the bone, and then try to find the angular artery, which is here. Because I'm seeing a little bit branch on top of the bone, and it's following a little bit superficial and give like just branching off the lateral nasal artery, which is here on top of the cartilage, which is hypoechoic. Let's back to the piriform fossa and find the artery, which it's very interesting that I see a vessels on the bone. Let's try the vertical view. This is the B mode, and I see the piriform fossa, which you can see a darker hypoechoic area on top of the bone, which is hyperechoic. Now, check the vessels. The angular artery here in vertical view is superficial, but when I'm doing a little bit safe mapping, I see the branch on top of the bone. It means that maybe it's the trajectory of angular artery running a little bit deeper and then going to be superficial, or maybe it's duplex angular artery. For measurement from the skin to the upper part, it's almost 5 millimeter, And from the lower part of the vessels, this small branch is almost 1.5 millimeter. It means that I'm not going to use needle. I'm going to use the cannula 20/20 gauge with supracautious technique and then with the guide of ultrasound. Let's go to the other area, which is infraorbital. Now, as you can see, in the left side of the image, you see the tear trough, which is the white hyperechoic area, which is the ligament, and then bone just in the bottom part of the image. And here you can even see the LL-SUN muscle starting from left side on the bone and then going to be superficial. Now, with the little rotation of my scanner, I'm seeing this continuity in the bone, which is the foramen, and a little bit reverberation artifact, which is just the white line repeatedly. It's an artifact, but it helps us to find the foramen as well. Now, I'm going to the color and find the infraorbital foramen. I can bring this in the midline and turn on the midline marker and mark from the surface of the skin to avoid this area, or doing the treatment for support the infraorbital area and treating, volumizing the medial cheek with cannula, but definitely with the guide of ultrasound. Now, let's go to another area, which is the temple, and check if we have the branch supraperiosteal close to the swift point, or for the gunshot technique. I'm going to the temple, use the preset of the temple, start from the top area and make sure I'm seeing the all layers. Bone in the bottom, hyperechoic line, epidermis on top, hyperechoic line. Then I see the temporalis muscle. I can ask my patient to maybe clench, and the movement of the muscle, you see that become bulky. And then on top is the white hyperechoic line, black on top, and then white again, which is the two lamina of the temporal fascia. And then on top we have the superficial fascia, subcutaneous, and skin. Let's go to the area that we are going to inject. Turn on the midline marker, turn on the color or power Doppler, and then try to check the area if there is a vessel. Yeah, I make sure that I'm on top. Usually we make a mark on top of the skin. Here is the anterior deep temporal artery, which make it very dangerous to go blind with naked eye and then inject supraperiosteally, because as we all know, this is branching off one artery, zygomaticotemporal, and entering the orbit and anastomosis with lacrimal artery, one of the terminal branch of ophthalmic artery, and the chance of blindness. Okay, and for the injection, sometimes we might, use our ultrasound to just check the superficial temporal artery, which is close to the hairline here. We'll see if I can get the flow. Yeah, I bring it in the midline, and you see this is superficial temporal artery. Let's go to another area, the last part I'm showing today, which is supraorbital and supratrochlear. I'm still using the preset for the forehead and use more ultrasound gel. Okay. Again, I start with B mode. Here on top you see epidermis and bone. Between these two hyperechoic line, I'm seeing orbicularis oculi muscle. But if you check, this is the bone. With the small tilting, the bone becomes a little bit like discontinuing the two sides, which is the foramen or notch. Let's go medially, find the head of corrugator muscle, and on top we see supratrochlear, which here is deep on the bone, and sometimes it becomes superficial or sometimes two layer, is on the bone. Now I'm gliding just laterally, again B mode, to find the supraorbital foramen, which you can see in the midline, and then again color Doppler to find the pulse here, as we see. Sometimes you cannot see the flow running through the foramen, but you see the perforator here, and you can mark it from the surface. This is how you do the safe mapping for facial vascular anatomy. This episode just ends, but the ultrasound for the face never ends. And I hope that you learn this technology as fast as you can. Thank you for joining us at FACT Facial Assessment with Clarius Technology, and stay tuned for our next episode.